everybody. I hope you're doing amazing. So today we are going to talk about IVF and genetics. All right, so let me introduce myself. My name is Anjali, or Ange if you like to call me. So I am women's health movement coach, and Dr. Miriam is here already. And I am also nutrition counselor as well as founder of this platform. Let me welcome coming on now. So I'm going to say hello. If you can hear me okay, please give me a thumbs up. Hello, Dr. Miriam. Welcome.
Hello, Ange. How are you?
Yeah, thank you for your time. And
thank you. Thanks for inviting me.
Yeah, amazing. Thank you. And I have heard amazing things about you and how amazing your service is.
Thank you.
We are so honored to have you on our Focus Women's Health platform.
Thank you.
So welcome everybody. If you can hear us, please give us a thumbs up, and we get to ask questions as well. If you have any question, please pop it in the comment section, and Dr. Miriam will try to get back to you as soon as possible. All right. So before we start, I would like to read Dr. Miriam's bio. All right. Thank you. Okay, we got thumbs up so everyone can hear us nice and loud. So Dr. Miriam Lee is a consultant, gynecologist, and fertility specialist who has been in private practice on the Gold Coast for 20 years. During last decades, she has helped nurture new life for many women and couples on the Gold Coast. She is the first woman specialist to practice purely general fertility, health, and gynaecology on the Gold Coast. This year, she has started a fertility preservation clinic in Southport called the Focus Clinic. Dr. Miriam hopes that this will be able to help more women understand and take better care of their reproductive health. Thank you, Dr. Miriam. Your service is amazing.
Yeah, thanks, Ange. Thanks for the opportunity to have a chat today, talking about all aspects of fertility. And I hope we can be of help to your listener and, empower them in getting some information.
Yes, that would be amazing. I think that we have a few people that are coming along. So before we start, I would like to read the disclaimer that this chat is all about to bring awareness and educate people around IVF and the genetic side, but not a specific advice for anybody, right? So if you need support around this topic, please contact Dr. Miriam and her clinic. I will put all the details in the content down below. All right. Dr. Miriam, would you like to add anything before we start?
No, that's very good. Thank you so much, Ange. Yeah, you've covered all.
Yes. Should we dive in the question?
Yep. Okay. Sounds good.
All right. Okay. So very general question is very basic. That what is IVF for people who are trying to explore this topic or who are very new to this?
Okay, so IVF stands for in vitro fertilization. So in other words, fertilizing outside the body. It's one method of many other methods that to help people conceive. And the whole lot of method is called assisted reproductive technology, and IVF is just one of them.
All right, amazing. So we have lots of other ways that, so we covered the full form of the IVF, and then what were the other ones? Sorry.
Like insemination. So IVF is getting the egg and sperm fertilizing on the outside, making a fertilized embryo, and then putting back in the woman. We have methods like insemination where we don't actually see the fertilization. We just concentrate the sperm and put it into the woman's uterus that way. That it's in vivo because the fertilization is inside, not on the outside. So, IVF, and then there's other things like ICSI where we actually inject the sperm into the egg, which is a little higher level than IVF. So there's just a whole bunch of options that people use to help couples conceive, and everybody's different. It depends on their situation, what's best for them.
Yes, so it's all so many options that people can, explore, right?
Yes, yeah, and their doctor specialists would guide them.
Okay, amazing. So can healthy habits or nutritional changes improve the quality of eggs, sperm, or overall IVF outcomes?
Well, I was going to maybe that's a big topic if we can break it up into healthy eggs, healthy sperm, and then healthy uterus, because that's the three components that makes a pregnancy, isn't it? So for women, number one, I guess, whether it's a health habit or not, age is a major factor. People don't realize, you're born with a number of eggs, you don't get any new eggs later in life, and your number of eggs drop as you get older. So, best eggs are the youngest eggs, and that's where we at our clinic really look at fertility health, because you don't know when your eggs start to decline. You're born with a certain number of eggs, but some people, their decline is faster than another person, and it's totally asymptomatic. You don't know. So that's one thing that, women may need to get checked out. I mean, even though you may be 25-year-old or 30-year-old, your eggs may not be the same as another person who's 30 years old.
I was going to ask, so what is the young range and what is the old range? But you said that everyone is different.
Well, in general, from 30 onwards, 32, 33 onwards, your eggs will definitely be decline. Not as good as before, yes. But, some people faster than other, and definitely after 40, it's not great.
Okay.
Yeah.
So
Yeah, so that's age factor. But then health, lifestyle, weight, very important. Being underweight or overweight is no good. Just even losing 10% of your weight when you're overweight can make all the difference, because that can help your hormones, make you ovulate more regularly. So weight is a really important thing. Lifestyle, as in diet, doesn't really make that much difference as long as it's a balanced diet. We talk about vitamins a lot, giving multivitamins, but the conception rate doesn't really change, whether you take more iron or more calcium or folate, which are the essential ones. But it's the fact that when you fall pregnant, you need those vitamins. So you need to lay down these very essential vitamins before you actually conceive. From conception, 3 months, in fact, before conception. So that's why we say to patients, take multivitamins. It may not affect your conception, but it will definitely affect the health of your baby. Yeah. And other things like alcohol, we know is not great while you're trying to conceive, not more than 4 drinks a week. And then once you're pregnant, there's no safe dose. So, And then smoking and vaping, definitely no. Recreational drugs is not a great thing. And then caffeine can have some effect. Shouldn't be more than 4 caffeine drinks a day. And then just generally exercising is good, but not more than 5 hours a week.
Oh, okay. So I'm intrigued that even the underweight can impact it.
Yes. Over-exercise, underweight definitely is a problem.
Yes. So I have been through that stage when I over-exercised myself, and then I was losing my period. So, that you don't want that, right?
Yes, you see that in elite athletes, ballerina, that they exercise very sort of high intensity, a lot more than 2 or 3 hours a day, and that's where you see the problems. It's almost like your body is protecting you in a way that you're not healthy, so it doesn't want you to conceive. So it's like a starvation mode. That happened when the World War II happened. People lose their periods because they're under a lot of stress, and your body doesn't want to reproduce to protect your offspring, And that's
Yeah.
exactly what's created with over-exercise.
Yeah, wow. Your body is so clever, isn't it?
Yes,
It's
it's
incredible.
protecting you. Yeah.
Yes. So, yeah, at that time we might not understand, but the whole thing happening is just because your body is trying to protect you and the
Yes.
baby, of course.
Yes. 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 Stop you from producing unhealthy babies.
Yes, that's incredible. So I was just going to recap the points that you said. So age of the women, right? And the weight, the overweight or underweight, and the lifestyle, and the
Yes.
diet as well, and the alcohol, lastly, right?
Yes. Yeah. Okay. Now moving on to sperms. Men are pretty lucky because age is not a big deal for them. Very, very slight change after 40, but they reproduce their sperm every 72 days. So it's not a problem with men. Things like exercise, caffeine doesn't really make much difference, but weight is another problem. Overweight and underweight is a problem with men. And then smoking again affects your sperm. And then if you smoke, you are creating a passive smoking for your partner and for her eggs. So that's a no-no. Yeah. Yeah. And then alcohol, not more than 2 drinks a day is important for men because it does affect sperm count. And then the myth about keeping the testes cool is true. You know, wearing loose clothing, it's when you're trying, it's good too. Yeah.
Oh, okay. So it's for men, it doesn't affect as much around the eggs, you know,
Yes, age
but
factor. Yeah.
age
Yeah.
factor. But yes, if they can look after the weight, lifestyle, diet, and alcohol,
And
and
smoking. Yeah.
yes, and smoking, yes, and then that will help the, healthy,
The sperm. Yeah.
healthy
Yeah.
sperm. Yeah,
Yeah.
amazing. All
Yeah.
right. So I guess if the partner doesn't drink as much, or it won't for the women, it won't be as hard for them to look after themselves as well, right? It's a
Yes, yeah,
teamwork,
it's a team
isn't it?
effort, absolutely. Yes, yes, yes. Yeah, it's very
Yeah,
true. Yeah.
yeah. So anything else we have to cover on this under this
Oh, the
topic?
last one, a healthy uterus. So
Yes.
fortunately, the uterus doesn't age. So, that's where we see women who have used donated eggs when they're past the age where the eggs are healthy, because as long as the uterus is normal shape, no fibroids, no polyp, then they are able to implant an embryo. Yeah.
Oh, amazing. So it doesn't age.
Yeah, no. If we can stimulate it. So even the period stop, we can use hormones to stimulate and
Oh,
let the
wow.
embryo grow.
Yeah, that's amazing, right?
Yeah. That's why you hear people having babies when they're like 50 or something like that. And that's
Yes.
with
So it's
using someone
incredible.
else's eggs. Yeah.
Yes, the human body is just
Yes.
like magical, right? When you
Yeah.
know how it
Yes.
works.
Yes. Yeah.
Wow. All right. So let's move on to another one. So how do cultural or ethnic differences influence the experience or outcomes of IVF?
So let's look at the outcome. So um, one of the things that's been available now is a test called AMH, or in the community, a bit like an egg timer test. So I talked about how eggs decline when you get older. And we have a way of testing the blood to tell you if your egg count is good or it's not so good. And there are variation in different race.
Yes.
So, for example, Asian and Latina population, they start with a little bit higher AMH at the younger end, like in the 20s. But the AMH, just like our eggs, goes down like this. In the white population, European population, it goes down sort of slowly. But in the Latina and the Chinese group or Asian group goes much faster. So there are variation so we see that as well in Asian women, that they tend to have menopause earlier than the European cohort.
Oh, wow. Okay.
Yeah, so there are differences in when your eggs are the best in different rates. Yeah.
Yeah.
As for outcome, there are American studies that says, you know, the white American do better than the non-white, but I think it's very hard to tease out whether it's a socio-economic situation or is it truly a difference.
Yes.
But here in Australia, we're pretty lucky because even though most of fertility treatment is in the private health system,
Yes.
Medicare does support some of it.
Yeah.
So so that can be that we have more access to fertility treatment and And then as for the cultural effect, in a lot of Asian country, the use of donated sperm or egg is not as acceptable, especially like same-sex couples. If they have, some countries have to say that you're married in a marriage situation, then you can use a donor sperm or donor egg. A lot of Asian countries don't allow that, and so we sometimes see patients over here because we allow for that to be done. Yeah.
Oh wow. Okay. So because because of the cultural thing?
Yeah, and also I think it's in the law as well.
Oh yes.
Cultural, in the law, and I guess cultural awareness is not as acceptable. Yeah.
Acceptable. Yes. Well, I can understand that because we are really back home. We are really strict about those kind of things, right? The cultural. Yes. No, I get that side of it, and but I didn't think of that would be the case.
Yeah. No, they do have. Yeah, they don't allow it. Yeah.
Yes. Okay. Yeah. In Nepal, it is getting becoming more and more popular.
Right.
The IVF, but I don't know what the the situation like that would be like. So yeah. So what are the emotional or physical aspects should couples be prepared for when considering IVF?
So I think there's a lot of emotional aspect, and I want to break it down into three components. The first, when you first come to the doctor with the fertility problem, then when you're actually going through the treatment, and then finally at the end of your treatment. So in the initial part is a lot of shock, just finding out that there's a problem. But you got to remember, 1 in 6 couple have this problem. So the embarrassment and shame, really have to understand that you're not the only one. So you reach out to your doctor, reach out to people who you can confide with, because there's a lot of emotion in the beginning, getting the diagnosis and realizing this is happening. So, and then I say to people, when you actually know there's a problem, think about, look into fertility treatment, read about it yourself, and things like have prepared with questions when you go to your doctor, such as, how many children I want to have. I know I have this problem now, but so that they can plan for you. They can look at your situation and give you help. Yeah. And you should maybe understand that in yourself, how comfortable you are with all these technology treatment. You may have a stop level. I don't want to go down that path, but have that in mind, so that when you go to the doctor, you will have some understanding, and so that you won't be so shocked when they say you got to have this, because you might be more prepared. Yes. And then, of course, communicating between you and your partner is very important, and keeping that communication going. And then the second part I want to briefly talk about is during the treatment, because when you get IVF, you're getting hormone injections, so your emotions are fluctuating all the time. Yes. So, it's understandable you feel upset and happy and varying. And and also when you are undergoing treatment, to remember that don't put all your life on hold just for the treatment. You still got to be normal. You still got to have your time, have your family time, and have your partner time, have your date night. Don't put that on hold in your life. Yeah. And then finally, finishing the treatment is really understanding that, yes, you could be pregnant, which is fantastic, or you may not be pregnant. And that how you can, I guess, get yourself back together, and, and discuss more with your
Yeah.
specialist, alternative, and so on. And again, keeping the communication open with your partner.
Yeah. So so every 1 in 6 couple has this issue, right? So this is not a shameful thing, but
Absolutely not.
yeah, but if we, and before you start this, before you start opening towards IVF, educate yourself
Yes.
and have all the questions ready for your doctor, so you'll be, like as much informed as possible, right?
Exactly.
And
Exactly.
then you'll be prepared for amazing outcome or
Mm.
not so good, but at the
Exactly.
same time be able to respond to it instead of being reactive, right?
Yes.
And at the same time, remember to live your life.
Absolutely. You summarized that perfectly, Angie.
I'm writing I'm a good student. I'm trying to be a good student.
You're a very
So,
good student. Yeah, yeah,
yeah,
yeah,
thank you.
yeah,
So
yeah.
people can, you know, yeah, when we revise it, so people can read that again and then understand better. All right. So, what are the future developments in fertility and genetics give you the most hope for families struggling to conceive?
So at the moment, we are able to test the embryo. So as I said, the egg and sperm get fertilized and then they grow for 5 days. The 5 days mark is where it starts to differentiate into a placenta cells or the cells of the actual baby. So we are able to take 3 or 4 cells from the placenta and then test it. So the testing for various reasons. Commonest is to exclude miscarriage because 25% of pregnancy do miscarry, and that's because of when you have the 2 chromosomes coming together, it doesn't divide perfectly. So there will always be errors. So we can determine from what we call PGTA whether this embryo that's going to miscarry and not to use it. And there's 3 other forms of this similar testing for diseases. So if you have a family history, one of the commonest one is like cystic fibrosis or Huntington's disease. We have a probe or actual disease gene that we know, and we can detect that in that embryo and then don't use those. And then there's one other one where there's a sort of a twisting or switching of the genes that is a patient can be a carrier. We can also detect that and not use those embryos. So that's been around for quite a while. And the future, which is experimental at this stage, but will be available one day, is where you might have heard of 3 persons IVF. So whereby so in a cell, this is, I'm not a scientist, so my explanation is very simple.
Yes.
In a cell, you've got the gene of the person, and then
Yes.
you've got the powerhouse, which is called the mitochondria. Now, most diseases are from the genes, but some are in the powerhouse. And right now, all the tests have always been on the DNA, but and we haven't been able to overcome the mitochondria part.
Yes.
So what we actually can do is use a mother who has abnormal mitochondria, take her DNA out and put it into someone else's egg with normal mitochondria, and then put it with the sperm, and then create a baby that is the mother's genes but doesn't have the mitochondrial disease. So we've done that with animals, but now we're in the stage of doing on humans, and that's the next step in fertility genetic testing.
Oh, wow, that would be exciting.
Yes, it would be indeed. Yes. Yeah.
So it's incredible what the, science has brought. And, it's already amazing what IVF is, how many lives it has given to families.
Given hope. Yes.
Yeah, given hope. And because coming from my background in Nepal, it was like if you hold hands or you will fall pregnant, right?
Yes, yes,
And
yeah,
that's
yeah.
not the, and I always grew up thinking in that way,
Yeah,
and
yeah,
then
yeah.
never look at the men or or boys.
Yes.
And then now here we come to this era where you know, we haven't been able to do, you know, fall pregnant, and the science has brought so much, you know, I think hope and joy in the families, and that is amazing. And the new finding is incredible, and it will be amazing when it comes to apply in the community.
Yes,
Right.
exactly.
Yeah.
Yes, yeah, yeah.
So, yeah, if anyone has any questions, please pop it in the comment section. We are opening to everybody. And while we wait for the question, Dr. Miriam, how can we find your work? People can find your work. What is
Well,
the best way to connect with
yeah,
you?
I practice out of Southport, and my clinic is under my name, Dr. Miriam Lee, and also I have a small fertility preservation clinic called Focus, which you mentioned before. So
Yes.
yes, you can look me up in the if you look up Focus Fertility Preservation or just Dr. Miriam Lee, you'll be able to find my
Yeah.
number. Yeah.
Yeah, so we will put all that information down in the content section.
Mm-hmm.
And also you have event coming, the free event for the IVF information, right? On the
Yes,
3rd of
yes.
December,
Yes, yes,
right?
thanks, Angie. Yes, yeah, yeah,
Yes.
yes. So in our clinic, we actually bulk bill patients for the fertility health check by our GP.
Mm.
So we want to let others know that, yeah, this is available and that information night is about that. Yeah.
Yes, so people can come along and it's free, right? So it
Yes,
will be
absolutely
amazing
free.
for people
Yeah.
to understand, or if they're trying to conceive and, you know, all the information. So Beck is asking, Dr. Lee, can you tell us more about the free fertility checks and AMH test and why that's important?
Yeah, so as I mentioned before, you know, if your eggs are deteriorating, even though you may be, you know, in your early 30s, you actually don't know about it. So that's where fertility health check is important. So our clinic can provide that as a bulk billing service. We go through all the checklists of fertility health, and then we'll send our patients off to do the AMH test. And that AMH test can give the patient an idea how healthy the eggs are and how many, and you know, with family planning, that if they're very low, we would say to them, you need to consider starting a family soon. If you're not in a position to do that, look at fertility preservation, egg freezing.
You were talking about embryo freezing as well last time when
Yes,
I spoke to
yes,
you, right?
yeah,
So
yeah.
what's the difference between yeah, I think you mentioned that as well, the egg freezing and the embryo freezing.
Yeah,
So,
embryo freezing is just a fertilized egg
yes.
that if you are in a relationship, we can put them on hold if you're not ready to get pregnant.
Yes. So it's just that the little bit difference. Yeah.
Yes.
Okay. Yeah. I hope, Beck, you got all the answers. And if you have anybody has any more questions, please pop it in the comment section, and we will put. And if you wish to connect with Dr. Lee, you can always, you know, message me. I can pass it through, or you can. Can they directly contact
Yeah,
you at the
I have the
practice?
Instagram on in Focus has a Instagram. You can message us through that too as well.
Okay,
Yeah.
awesome. Beck is asking, can you tell us why women are freezing their eggs? Is it a career?
Well, a lot of them is because of could be career or relationship. You know, we see situations where some maybe some for um, 10 years, and then when they're ready to get pregnant, something happens, and so that you, you find yourself in your early 30s. You may not meet another partner for a while, and then it's a good time to consider having your eggs frozen.
The
Yeah, it's
early,
just life situation, I guess. Yeah.
yes. So Sarah, how do I say? Sorry about that. I say Sarah. I don't know how to say your name, but is there a risk with thawing of an embryo prior to transfer rather than a fresh embryo transfer?
No, frozen embryos have just as good success rate as fresh embryo transfer. Yes, we found that in the data. Sometimes it's even better frozen because when you the fresh embryo situation is when you've come off the back of having an IVF cycle, so your hormones are very high, and so that it's probably not in a sort of a natural situation. Whereas if you're doing frozen, you're in your natural cycle, and it actually, you do to have a good success rate with them as well. Yeah.
That's it. Okay. All right. Thank you, Sarah, for your question. And all right. So if anyone has any more question, we will take one last question and we will have to sign off because we are more than yeah. All right. Okay. So all right. There is no question. So if anyone has any question, please pop it. Direct message me and I will pass it on to Dr. Lee. And you can always comment in our comment section in our live as well, the video. So we will, as Dr. Miriam and I will collaborate, and we will be able to reply you on that as well. So thank you, Dr. Miriam, for being
Thank you, Ange. Thanks very much for the opportunity.
That's
chatting.
amazing. It's our pleasure, and our community got so much value out of it. And then, thank you so much, everyone, for such an interactive, they're coming, asking questions, Beck and, Sari, and we really appreciate your, participation. Thank you so much, everybody.
Thanks, Ange. Thank you. Good night.
Have a great evening. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Bye-bye.